Hey everybody, just wanted to help out a couple climbing buddies of mine, but I think that this next piece is going to be very helpful for a lot of people and clinicians as well, of how to take care of a little bit of what we know as tennis elbow. Okay, now it's called by a bunch of different things, but you know, tennis elbow is the common term, but we can get an irritated elbow for a variety of different reasons. But often what I find is the pain that you have here at the elbow has nothing to do with the elbow. It's actually at the shoulder, and we'll cover that next time. But you want to make sure and you want to look for any weaknesses that exist here in the shoulder, particularly at the rotator cuff and the serratus anterior, because this is the weak link in the chain here that often takes the stress for a sort of weak proximal segment. So when this gets irritated, however, we can do a couple things and give a few of these self-treatment techniques to our patients to treat this sort of hyperactive, contracted tissue here. Now keep in mind, both of these work together, so the problem may actually lie here more in the flexors, but they may be feeling with pain here, but we may have to release over here as well. So I'll show you two releases, self-releases today that will help, one, relieve the tension at the elbow, improve the strength, and also start again the healing process.
So one of the things I mentioned previously is that a lot of times the elbow pain that a patient has, whether it's tennis elbow or golfer's elbow, has nothing to do with the elbow, it's coming from the shoulder. So one thing you can do to check that is have the patient up here, apply pressure here, and if it collapses really quickly, there's some neuromuscular shutdown in the shoulder, and that has to be investigated and treated further. But let's look at a couple tips and a couple techniques that you can do both individually and also for your patient to make your elbow feel a little better.
So when the tissues get really irritated, one of the sort of things that sort of bind up and hold the ability for this to heal is things are all twisted. It's much like this finger trap here, and essentially what I'm going to show you is a position release therapy release technique that essentially gets this finger trap undone here. And so just like the finger trap, okay, when we're sort of tight and irritated and painful, we have lots of tension there. And you can think about this as like a little muscle spindle, like a little neurologic spring, and there's lots of these in the tissues here. And so rather than tug on it and pull on it, which gives us more tension and more pain and spasm, what we do essentially is we push it together, twist it, compress it, and it comes undone. So I'm going to show you a technique now that helps us make that happen. So when relieving or releasing the sort of lateral compartment here, particularly the extensor carpi radialis and brevis, and in our textbook there's really cool pictures and also videos and self-release techniques. However, if you don't have the opportunity to see a positional release therapist, or you don't have someone that can do the technique on yourself, here's what you can do on your own. So position your arm, let me get this up a little more, like on a kitchen table or a bench or something like that that has a little bit of firmness to it. What you're going to do is you're going to put your hand, you're going to basically put your hand right on top of your other hand here, okay? And you're going to essentially extend the wrist, okay? Just nice and gentle. And the thumb side, okay, the radial side, you want to tilt towards the lateral elbow. So tilt that towards the lateral elbow and then push down with lots of compressive force. Now, obviously you don't want to feel pain in this. We want it to be completely painless. And our motto is no pain, all gain, because we know that when we cause pain, it can provide some additional challenges to tissue healing. So we want to hold that, and you can kind of rock it back and forth to where you feel most comfortable. And we want to hold that for at least probably 2 to 3 minutes. Now that's a self-release. If your positional release therapist is doing it, then it becomes a little more effective. They can rotate, they can also palpate down here for the little neural reflex they're trying to sort of elicit. But this can go a long way in relieving the tension at the lateral elbow. Now, if it's on the inside, we just reverse that. Okay, so now we go over top of the hand. Be careful doing this too much because this can cause too much stress here. So we want to be kind of like right over the bone here. And so as before, we want to tilt, so this pinky side is going to come down towards the medial side. So we push down, we rotate back and forth, feel for where it's most comfortable, and again, hold for 2 to 3 minutes. So once you've released that elbow, and I'm going to recommend you probably release the medial compartment as well as the lateral, both. There's other releases to be done, such as the pronator teres, and we'll maybe post it up in a short period of time. But once that's has blood flow running to it, it's ready, it's a good time to massage it. And so typically, if you kind of palpate that brachioradialis muscle, it's our big muscle right here, or kind of hammer muscle, right along there is the common extensor tendon. And that's a good place to start. And so massaging that down for 3 to 5 minutes is really good. And you can go all directions and pull across it and do a variety of different massage. But after that, use a tool, and there's lots of them out there, but just the back of a butter knife, not the sharp end, so not this sharp piece, but you know, kind of the beveled end, or back of a wonton soup spoon, is take that with put some emollient or some lotion there, and essentially pull down that, scrape that, okay? Go across it, okay? It should not be real painful. Like a 1 discomfort is fine, but if it's really hurting, you got to ease up on that. We don't want more pain, which then causes that spasm. And so, but this will help break tissue adhesions, okay? Doing that on a regular basis. Then you can get more focused. You can kind of really get in there, stimulate the tenocytes to grow and respond. That's a great technique as well. Now, once that's done, then let's pump some blood flow to it.